Why MedTech? Why you? Why now? Because it's only a matter of time before you or a loved one are caught in an emergency situation, and you are the first responder. On average, it will take 10 minutes for professional first responders to arrive. Yet the brain, heart, and vital organs begin to die after 3 to 4 minutes without oxygen. You really will be the first responder, and the most critical life-saving actions are up to you. Are you ready? Major disaster and accident studies reveal that we behave better and worse than we hope. In an emergency situation, humans sometimes fight, sometimes take flight, but most often, we freeze. What will you do if an adult or child has a sudden cardiac arrest right in front of you? Or you come across someone with an opioid overdose? Will you know how to save them and keep yourself safe as well? What about a car or bicycle accident? Or even worse, an active shooter event with people who have severe bleeding and need help right away? What if someone is choking in a restaurant? Or you're at a beach and someone looks like they've drowned? Or someone who has a life-threatening allergy is bitten by a bee, or has an allergic reaction to food or medication and has just moments before they may die. Or you observe behaviors of concern that can lead to physical harm of others, including children. Why MedTech? Because it's the only integrated program in the world that prepares you for the most common emergency scenes you will encounter. Why you? Because you alone may be the real first responder. Why now? Because the odds are that you will be at the scene of a healthcare emergency much sooner than you think. And the victim may be someone you love, or could even be you. This video introduces a global bystander care training program that saves lives before professional first responders arrive. It is the first of its kind in the world. Our leadership team includes national medical leaders, educators, biomedical engineering experts, as well as law enforcement threat safety science experts who have tackled the most frequent, severe, and preventable causes of harm to children and adults with one integrated approach. The training initiative is the Medical Tactical Certificate Program, called MedTech for short. Our fight is against what is known as failure to rescue, and our battle is to beat the clock. It all began with a leading physician identifying a critical need. A lower school student and Cub Scout wanting to undertake an Eagle Scout project before becoming a Boy Scout, threat safety performance experts guiding our focus, and a multi-generational team willing to help others. It started with lower school students and Cub Scouts, expanded to upper school students and Boy Scouts, families pursuing disaster preparedness, and is now scaled to train faculty and college students at some of our leading universities and law enforcement at global medical centers. The first life was saved in just the first 7 weeks of our very first after-school program, and even more were saved in the months that followed. This drove our cause. We expanded our reach to tackle entire public school districts for students, educators, and school nurses, faith-based organizations with special programs for security, medical volunteers, and ministry teams, scout and membership organizations focused on both the youth and their leaders, and developed programs for lifeguards and surfers and beach communities, recreational divers, rescue divers, and their instructors, skiers, snowboarders, and summer mountain sport enthusiasts, and sports teams such as water polo and football. Our Adopt a Cove program is placing AEDs and bleeding control supplies at multiple beaches that are dramatically reducing the response to care times. We are piloting performance networks in California, Hawaii, Texas, Minnesota, Florida, Massachusetts, and tackling the real challenges in mountain communities in Colorado and Montana. We launched the program for young adults at Stanford University with students from medical schools and undergraduate programs, including student athletes from multiple sports. Our program at the University of California at Irvine with faculty and student leaders deploys training and emergency gear across the campus. Our East Coast launch occurred with the University of Florida, led by pre-med students who are now MedTech instructors. Our Northeast program includes Harvard, MIT, and Tufts students, as well as faculty and local community leaders, and we've engaged students, alumni, and faculty at leading universities to drive awareness through colleges and through a network of high schools. Our weekend family program trains families in disaster preparedness as well as MedTech lifeline behaviors, where they earn the American Heart Association Heart Saver CPR AED certificate and the American College of Surgeons Stop the Bleed certificate for achieving competencies in these lifeline behaviors. Our comprehensive program for law enforcement officers and first responders was launched at the University of Texas Police Department and the MD Anderson Cancer Center, as was our program for caregivers to handle in-flight aviation emergencies. Responding to the rise of lethal force incidents at faith-based organizations, we developed an all-faiths health security certification for security and medical volunteers, a special program for Eagle Scout candidates who want to start a MedTech program in their community. When the COVID crisis struck in March of 2020, we launched a rapid response coronavirus community of practice and an R&D program targeting family spread in essential workers. Expanded to the general public, and now in 2021, we will run it through the reopening bridge until the pandemic threat is gone, and we have landed at the new normal. The blessing of the crisis was that it drove us to convert our entire MedTech program to be delivered remotely through live Zoom and online content. This now allows us to train anyone, anywhere over the internet. They will learn how to perform COVID-safe Good Samaritan bystander rescue care practices everyone will need to know at the new normal. We'll give them an extraordinary leadership experience in fostering life-saving programs where they live. Students learn the lifeline behaviors to protect harm from the most common health hazards to children, youth, and adults. They include sudden cardiac arrest, choking and drowning, opioid overdoses and poisons, life-threatening allergic reactions to food, medicines, and insect bites, major trauma injuries, common accidents, non-traffic-related drive-over accidents, and bullying. For sudden cardiac arrest, students learn CPR and how to use an automatic external defibrillator called an AED, and how to make an effective 911 call. For choking, they learn the life-saving Heimlich maneuver, and for drowning, critical rescue breathing and resuscitation skills. For opioid overdose and poisoning, they learn about prevention approaches, how to use opioid reversal agents, and the skills of self-protection from these very dangerous substances. For life-threatening allergies and anaphylaxis, they learn about using epinephrine auto-injectors such as EpiPens. For major trauma, they learn how to use direct pressure, tourniquets, and wound packing to stop bleeding, which earns them a certification from the National Stop the Bleed program. For certain common accidents, they learn scene safety and how to prevent injuries and infections. They learn how to prevent non-traffic drive-over accidents, and they'll learn the importance of preventing and dealing with bullying and how it can lead to harm, self-harm, and even death. In the spring of 2018, we shared the MedTech program with a group of young entrepreneurs and innovators at the NASA Kennedy Space Center at the Conrad Innovation Summit. We challenged them to start programs in their communities. Our strategy is to create a team of teams and a network of networks using an all-teach, all-learn approach with our multi-generational group of leaders. Following that conference, the MedTech team was awarded the 2018 Pete Conrad Global Patient Safety Award for developing our high-performance, life-saving programs that can be deployed in any community around the world. Campus Safety Magazine featured our Tac Story article on its December 2018 cover. According to the editors, the message was so positively received by safety leaders of universities, schools, and faith-based organizations that we were asked to write a series. The second article addressed dealing with active shooter events in hospitals. The third teaches leaders how to form and run rapid response teams that can get to a victim and save lives within 3 minutes. And the fourth addresses the specifics about placement of automated external defibrillators and bleeding control supplies. Our article addressing how family safety plans can be put together to tackle the COVID-19 crisis dealt with readiness, response, rescue, recovery, and how to make a family more resilient. It complemented our monthly live Family Survive and Thrive Guide broadcasts for families of critical essential workers and the general public that we produced for future online viewing. The team is also developing a number of innovations. One is a checklist tool called the Care Huddle. The Care Huddle is a critical actions response to emergencies checklist that can be used before any group event, such as an assembly or sporting event, to make sure someone will be responsible to call 911, meet first responders, do CPR, get the defibrillator, and help with epinephrine autoinjectors such as EpiPens and opioid reversal agents. The Care Huddle has been tested at scouting events, organized athletic events, and in church environments with a short briefing before an event begins. The response has been terrific. The Care Huddle will also be deployed as a smartphone application, as will our Care Moms program with incentives for taking MedTech courses. An app is in development to talk bystanders through the life-saving actions during an emergency, whether they have taken our MedTech training or not. The Care Pack, one of our earliest innovations, is a backpack that includes an AED, protective gear, the critical supplies such as tourniquets and bandages that can be used for severe trauma, and everything you need to practice the MedTech skills. Multiple Care Packs are now being studied and refined at schools in Southern California. We're developing versions for professional first responders and law enforcement, mountainous communities, and for lifeguards in Hawaii and California who have expressed tremendous interest. We've also developed a low-cost approach to create shrink-wrapped bleeding control kits for schools and outdoor environments. Finally, we've developed the first Good Samaritan liability protection for those who become fully MedTech certified. This has been a major milestone, as perceived liability is the major fear of bystanders and organizations who want to help others. Using a blended learning approach of online and on-site training, we've made the certification process very efficient and designed it to be funded by philanthropy. This allows us to make it free and rapidly scale it to schools, scouts, and faith-based organizations. The only cost to them are local instructors who are engaged directly by them for hands-on skill training. We will continue to deliver our program over Zoom and online for anyone, anywhere, while we're on the reopening bridge to the new normal. And we'll continue to teach COVID-safe practices of vaccination, mask use, avoiding crowded, poorly ventilated spaces, hand hygiene, and disinfection of surfaces. We want to challenge you to log on to our website to express your interest in starting a MedTech program, whether it would be with your school, college, with your athletic or club team, scout group, church, or faith-based organization. We have a program for you. We are looking for innovators like you to help us take our program global, develop apps, games, devices, or videos that can help save lives. In our world, everyone is a patient and everyone can be a caregiver. Please join our cause. You will share in the great blessing of watching children and their families experience the joy of serving others by teaching each other to save lives. To find out how you can join our global MedTech team and start a MedTech program in your community, register your interest and we'll be in contact with you. We need you.